So I think the striking thing that I took away from this is actually, you know, as a medic myself, I suddenly realised how little I know about periodontal disease and how much actually kind of we don't get taught necessarily about this at medical school. I was always told about the links with kind of rheumatic fever and the importance of antibiotics with that. And obviously as a rheumatologist, I knew about the kind of links between kind of rheumatoid arthritis. But this has really enlightened me. So I think the real I guess the starting question is what messages do we need to be giving doctors and wider medical profession? And how do we kind of get this kind of education out there to our kind of, I guess, our doctors in training, but I guess also our nurses in training, whether it's our kind of occupational therapists or whoever's actually seeing these patients, how do we get the wider message out there? And I don't know whether Maggie's the best question for that or Jason, I don't mind.
I'm very happy to start if you want, Jason, but I don't want to steal your thunder.
No, go ahead.
I mean, for the benefit of you and the audience, Zoe, I'd like to share with you the conversation I first had with Graham when we met. Jeanette, the president of the Radiologists, put us in touch because she seemed to say, well, you know all about public health. You talk to Graham because I think he's onto something, but I can't really tell what he's onto. So I was delighted to meet up with Graham. As a public health professional, I'm always very open-minded. And I'm always quite frustrated sometimes that we go into the big science. I mean, if you think we've spent 37 billion or thereabouts in test and trace, which is very frustrating for me and my public health colleagues because most of the really effective work has come from the public health system, not from the private companies, with all due respect to them, trying to run a system they've no idea how to run. And I was sharing with Graham this sort of long-term, you have to be really, really tenacious in public health because we have had some amazing public health successes, but quite often they take quite a long time. And sometimes people would rather spend a lot of money on something. You know, we've got the antivirals, which I'm on the antiviral board. I'm very proud of the work that's been done in antivirals. If you look at what we've achieved with PrEP and AIDS, I'm very open-minded that we could do wonderful things. The vaccine itself is a miracle of science, but we sometimes miss out on the simple solutions. So when Graham shared with me the work he was doing on mouthwash, I do have a sister who's a dentist, so I'm very well informed from her about when to use mouthwashes and when not to use mouthwashes. But I was intrigued and I said, let's be open-minded. But I warned Graham that we would need to bring all the resources of society onto this if we really wanted to make an impact, not just the big science, research and evidence, but actually winning hearts and minds is a big part of how you do public health. And I hope after today, the excellent session we've had today, even more people are convinced about the importance. We've always known in public health the importance of oral health, and we're very proud of our dental public health specialists, but it makes sense. We just need to help and educate people and keep the evidence coming in, you know, and not get, you know, remain resilient, because it might take us quite a long time to win everyone over. But having worked in hospitals myself and known how disregarded the oral health of patients is, you know, it's so vitally important. So highly commend everything that's going on. Delighted to be doing everything I can to support Graham, although that's very meagre, I hasten to add, Graham. But I do think you've got to be really, really tenacious and resilient, but make it fun in a friendly way, get people engaged and keep them with us. That's really what I think we need. Thank you.
Jason, do you have any further comments on that?
Yeah, I suppose from my perspective, it's about making sure that whilst oral health dentistry probably hasn't had the priority as far as the health service is concerned, to make it integral to all priorities and concerning everyone. So Mili made the point about this is essential care. It's not, you know, it's not mouth care matters. This is essential care. I mean, if you need a strap line, I suppose, you know, being it's time to put the mouth back in the body would probably do. And it's interesting, you were saying what would the solution be? When I was in the regions, I was working with the LMC medical director about where dental patients should go and the appropriate place for them, and we don't want. And he very proudly announced that I've had one session in an undergraduate level. Do you really want me to deal with your dentistry? Is how he talks to patients about it. And I think we can all agree one session in undergraduate is probably a little bit too little on that front. And I think it probably needs to start there, to be honest, Zoe. I think it's that. Dentists kind of enjoy the silo a little bit as well, and we've been trying to change that view as well, and making sure it's integrated. But it's integration and probably education right at the beginning would be my answer to the question.
I think I completely agree with that. I think that the integration of dentistry and medics, and as you said, that actually we're working for the common goal in patients, and as you said, not just kind of working in kind of silos. Mili, you've got some comments.
Yeah, just I found that actually sometimes with the medics, they don't, until they've actually had the talk, they don't really understand actually the importance. And actually we've had loads of really good interactions. So I've had the privilege to do training for GPs because they get lots of dental queries and they've been really enthusiastic. I've had, the British Geriatric Society have been great. They've asked our team to come back year on year and to speak at their national conferences because they provide that holistic approach to the older person. And they say they have no undergraduate or postgraduate training. Before the professions, if it's not on the curriculum, and they don't learn about it, they're not going to think it's important. And you go back from healthcare assistants, it not being even on the care certificate. And so it wasn't thought of as important. But, our cardiologists, and I've been really keen on training in our hospital, did a session with our diabetes consultants. And actually they said they didn't actually know the links. And that's why we're doing all this research, but somehow the messages just don't get back to the people that really need to do it hands-on. My mum's diabetic and her dentist has never told her diabetes consultant has never told her about the links between poor health and general health. And I think we need to put it in. Our Mouthcare Matters Leeds does lots of training with all professions, and that's where you've got somebody integrating the hospital, like you say, the infection control nurse who goes around to every profession. You've got that person teaching everybody the bits they need to know. So I think there is an appetite, but it's just like you say, being tenacious is just have to keep on going. Just being that boring person. They know me as the person that just keeps on going about Mouthcare. It's the links.
Yeah. And Mili, and you're absolutely brilliant, but I think it's making sure that we actually influence the people that actually look at the curriculum delivery, and actually how do we get this onto undergraduate teaching. I mean, I spent a lot of time learning about, as you say, kind of biochemistry, the Krebs cycle, kind of Iain, and all sorts of kind of things. But actually, kind of a lecture on kind of periodontal disease. And the links between kind of poor health would be fantastic at medical school. And again, obviously, kind of with nursing. Iain, you've got a comment.
Yeah, I agree with everything that's been said. Obviously, what I find striking is the dichotomy in knowledge about periodontal disease between the specialist medical community and the general community. If you talk to rheumatologists, they know it, and they know it in detail. Same with the cardiologists and same with the diabetologists. And so I think to a degree, the education is critical, not just at undergraduate level, and that's the starting point, but also at postgraduate level. I think having CPD on oral systemic links is really important. Then the other thing that, Jason hears me go on about this all the time. The other thing I think we've been really bad at is getting public health campaigns out there. Sometimes the pressure needs to come from the public and the patient, who's seen something, recognised it, thought, oh, hang on a minute, I'm going to ask my doctor about that, or I'm going to ask my dentist about that. And I think we really could do with investing, Maggie, that figure you've given is absolutely astonishing, the money that we have spent on track and trace. If a tiny, tiny proportion of that could be spent on a public health campaign about the importance of oral health, without scaremongering, nice and balanced, then I think it would have a huge impact. It would make everybody sit up and listen. Because at the end of the day, oral diseases are preventable, and it's not difficult. It's not rocket science to prevent oral diseases. And it's the chronicity that I think is important. It's the fact that if you have this inflammation in the mouth and you've got it for life, 10, 20, 30, 40, 50 years, what is it doing to your, what is it doing to your immune system? What's it doing to your blood vessels, etc.?
Well,
just in answer to those questions, I think just to paint the picture I know there are lots of dental colleagues listening to this and people who know about oral medicine. Just to paint the picture of how bad it is in terms of doctors knowing nothing. I went to Imperial College, had an excellent education. I was conscientious, and I think in the whole 5 years I had less than 1 full hour worth of lectures which dealt with dentistry. Now, clearly we learn about some of the oral manifestations of systemic diseases, but that's it's just a huge gap in my knowledge. I'm an expert anatomist. That's what radiologists are. And I specialise in the musculoskeletal system and a general radiologist. I deal with every part of the body. The only bit of the body I don't know anything about is probably the eye and the mouth. And so I'm trying to learn what there is to learn, and I'm learning every time I listen to Iain and others. But I think that this message is relevant to doctors. I think every medical student needs to be taught how to examine the mouth, because you can tell a huge amount about the body from the mouth, as we examine the hand, for example. I think not just medical students, but existing doctors need to be made aware of this. But I think there's a bigger picture here as well, which is, first of all, that the public need to know about this. And as I've said, we probably do need I think that saying that gum disease kills is probably maybe too stark a statement. It's you might need to break the news more gently rather than from a radiologist. We're not known for our bedside manner, but that's nevertheless a true statement. So I think the public do need to be made aware. My challenge, and maybe I can ask Jason about this, is what should dentists be telling people? Because I'm pretty good at going to the dentist. There may be a couple of times in my life when I haven't gone for a couple of years, but other than that, I go, particularly now, I go very regularly. But I've never been, and I'm bearing in mind that my dentists are watching this. I've never gone to the dentist and been told that if you don't look after your mouth, that you might die young, or that you might pick up all of these diseases. That's never a message that I've ever heard from a dentist. And I think that potentially is where, at that sort of grassroots level, maybe that message needs to come out.
Yes, it does. And Sarah's line about the putting the mouth back in the body, that was actually largely aimed at the dental profession, as much as it wasn't actually trying to lecture the public or talk to medical colleagues initially. So I think that's a message that we're trying to send, really, about the importance of that. And I think dentistry have been quite a surgical kind of field, really, and Iain taught me. I know he doesn't look old enough to have taught me, but Iain taught me at the time at Birmingham, and there was always this point about being an oral physician as much as the oral surgeon, although I did pick surgery to be the field to go into. But yeah, I think that's the key. Can I just answer? I was just about to answer Stephen Shallicum in the chat by the chat, but he was asking about the use of mouthwash. I'm going to controversially take that on, if that's okay, Graham. I mean,
what did he ask?
The question was essentially, had we deployed mouthwash, I think, at the time, would the shutting down dentistry have been avoided? I think that we're able to perhaps state that the lack of PPE had a significant part to play as well in terms of the suspension of face-to-face dentistry. A lot of debate went on about mouthwashes at the time in terms of the effectiveness of whether, once you've utilised it, how long have you got before that was actually washed away, and that was looked at in a great deal. There was also concern about deploying something that was simply for the protection of the staff rather than for the patient themselves, and what threshold that would set in terms of utilisation of that. Now, I'm fully aware there was huge debates going on, and I know that I think David outlined the pilot they did, but the decision that came to it just didn't meet the threshold that they felt could justify widespread sort of deployment, and the evidence wasn't there at the time to support it. that's what I would say. I mean, I wasn't part of the office right at the beginning of the pandemic, so I can't say, but certainly when I got into post, that was one of the discussions we had with the medical directorate, and other people sent that information in. So that's my understanding of it anyway.
David, then Iain.
Yeah, just a comment really. I think that rather than changing the curriculum or going back to how we educate medics, one of the things that you should do is raise expectations in the public of what they will receive as a standard of care. And you find that, you know, in modern change management programs, that's how things work. You know, so that's what you need to do so that the patient will go and have expectation of what will be a proper examination, what will be discussed with them about periodontal disease, because they become drivers then of people's behaviour and practice.
And I would agree with you there, David, but I think my concern actually is that you almost need a champion for every hospital. Now, we've got Graham as our champion, and as I said, basically, he's been kind of, when I say pestering, I mean in a nice way, the executive team. And actually, everyone actually in Salisbury actually knows about kind of Graham's kind of, you know, smile, and he's kind of and you know, and all the members of staff have, you know, we've all got our mouthwashes and things like that. So actually, you know, he really has promoted it. But as you said, every hospital doesn't have a Graham or a Mili, and it's getting that kind of, you know, those champions. We've got kind of alcohol champions and smoking champions and things like that. We need to have, you know, perhaps an oral healthcare champion for every hospital.
I mean, it's an interesting thing in that people have known about, you know, the relationship between, you know, dysglycemia and inflammation and infection in ICU patients for more than a decade. But actually, in a recent study in North America, I think there were 4,000 ICU patients across a research network that only 40% of them ever had their teeth brushed in ICU. So it's just, you know, so I worry that messages get lost.
Absolutely. Iain.
A couple of comments really. Just picking up on Graham's comment on, you know, gum disease will kill you. The dental community, the research community have been very conservative and remain quite conservative actually, Graham. And part of the reason for that was because when the original papers came out about the cardiovascular associations, the research community were naturally cynical. And they didn't want to talk about it until the research evidence base grew. And because dentistry is very small and funding research in dentistry is a nightmare, it's taken a long time for that research to gradually build up and to have that body of evidence that we've now got. And so I think, you know, there was a real concern that we might kill the message before the research data proved the message, if you see what I mean, and it would be dead and gone forever. So that was just a comment. On the mouth rinsing, again, I mean, this is a really interesting one. The professional community in dentistry have been against mouth rinsers and mouth rinsing probably for the last 40 years. And the reason for that is that the public would regard it as a quick way of attaining and maintaining oral hygiene. I don't need to brush my teeth, I'll just swallow with this mouth rinse. And the mechanical biofilm disruption is critical. That is what works. And it's only really a workshop held a few years ago where all the literature was reviewed systematically on mouthwashes that showed, do you know what? If you add a chemical mouthwash as an adjunct to mechanical cleaning, it does reduce inflammation and it does reduce biofilm even more. And that message literally has only just started to come out in the last year or two because the profession are just really, really anxious about killing important messages. And my final comment really, and Jason's heard me say this many times before, if we really want to get oral care embedded into people's behaviour, then we need to start with community midwives when they educate pregnant mothers about what they need to do to bring up a healthy baby. Because, you know, certainly my wife was like a sponge, and most of the other pregnant mums at the meetings that I went to, because I did go to the antenatal meetings, they're like sponges. When the first tooth erupts into the mouth, get a little baby toothbrush on it and get that behaviour implemented at the very start of life. It's cradle to grave, but it's really, really important. That can't be expensive to do, can it?
Yes, I mean, I must admit, I've loved everything that's been said today, and I love Iain's strap lines, and I'm very pleased. We'll come back again, Iain, and talk about oral health, because I can't comprehend why a country like England and the rest of the UK would be willing to have the main reason for children to go to hospital is to have their teeth out. I mean, it's just a shocking scandal. The Secretary of State's looking for new ideas, so I thought I'd reprogram that idea for him. It's not new, but you know, you've got to have everything new in politics. I think the point I wanted to make, Zoe, was back to how do we get this mainstreamed? And we've had some excellent ideas. I like the idea about the public challenging, but also I think part of my day job is running the training programme for public health in the Southwest. I know that we're all engaged nationally on the new doctor programmes, and I don't think we should waste an opportunity to get the proper education about the for all doctors and potentially nurses too, to have proper education and training on the dental aspects, the oral health aspects, and I think we could raise that now, and it would be in a timely fashion, because the programme for new generalist doctors is just being developed now. I know it's not just in the Southwest, it's across the country. So it'd be very good if we could take an action, and I'll certainly add my support to that.
That would be fantastic, Maggie. So we've got 2 or 3 minutes basically left. I guess the question that I want to ask is what is the take-home messages? So how can we as an audience actually be kind of preventing our own periodontal disease, but what are the key messages that we should be telling our patients kind of as of tomorrow?
I suppose I'm always going to advocate for those people who need support with mouth care, because a lot of people, we're all getting older, we don't know what's going to happen, and a lot of us here, we can all brush our teeth, we can floss, we can use mouthwashes, but I, as a clinician, every day I'm seeing people who need somebody else to help brush their teeth, and it's not being done, and the impact it has on them. And that's the message, you know, mouth care matters, and we really need to, you know, there's been some really, I've learned so much, and it's always fascinating to hear these speakers, but then I'll go onto the ward after this and I'll see somebody with their tongue stuck to the roof of their mouth who can't speak because nobody's looked in it and nobody's delivered fundamental dry mouth care. And that's why we have to keep pushing it from all the different angles, because we are an aging population, and there is a lot of public health dentistry that is delivered at the younger population, yet we don't have the same for the older population. We have programs in Wales, we have programs in Scotland, national programs, Caring for Smiles, Gwen and Bith, which are tackling these issues for people in care homes and hospitals, but we don't have one in England, and that's what I'd keep pushing. And to learn, let's not reinvent the wheel. We've done lots of good work. We just need some sort of national kind of work where we can pull it all together and all learn from each other.
Iain?
Yeah, I completely agree, Mili. Very, very well said. I think there's a couple of things I would flag. The first one is there was that white paper produced by the Economist Intelligence Unit. The figures involved in that are absolutely stunning in terms of the societal costs and the economic costs. And it's very, very clear that if you intervene early and you achieve oral health early, the return on investment, certainly in Europe, is huge. But it requires governments to take a medium term rather than a short term view. So if you want a strap line, I'd say time to take oral health seriously, time to take, I always say time to take gum disease seriously. But I think the final point really is, and again, something Mili alluded to, oral health and oral disease is an incredible canary in the mine for general health, but it's also an incredible barometer of social inequality. And it's the social inequality issue that I think is the biggest problem we face in England, certainly at the moment, because oral diseases like gum disease, like dental caries, they are highest in the groups that can't afford to access dental care, or don't have the information, haven't had the education, or it's not a priority because they're just trying to put meals on tables. And I think for me, that is a huge issue that we really need to focus on from a public health perspective.
Agreed. Graham?
Yeah, that's it's really interesting, and I think in this I wanted to stay away from the political side of things, and but I this is what I've said to other people. I think that we need to completely change the way that we fund health in this country. And my feeling is that we need to give all the money to preventative medicine and to public health measures. And then when those people have exhausted, that includes dentistry, and of course it does. And once all the money, but they've exhausted the money, then it can be passed on to other things that are essential. Yeah, I think it's very important to point out those disparities that Iain has mentioned.
Well, look, I'm going to close this meeting essentially because it's now 4:31, and I'm acutely aware that we started at 1 o'clock. But actually, I just want to say an enormous thank you to all the members of our panel. But I also want to say a big thank you to Martine Cross of the Wessex Clinical Research Network, who has helped with the administration of this. I'd like to say thank you to the Salisbury Hospital, particularly IT and registration, particularly Liam Thornhill, Mark Poultney, Scott Swinton and Dave Roberts. And finally, I hope you found it all interesting. I've certainly found it insightful. I've learned a lot personally. And fingers crossed that actually we can actually make things actually happen as a result of this symposium. I understand it's all recorded. Is there any other messages that I've missed out, Graham, or that you want to tell the audience?
Just a big thank you to you, Zoe, for hosting us as well. And just a reminder that at the bottom of the programme, the invite that everyone had, there is an email that people can contact us if need be. And we'll think about how we can make these videos available as well for future or later viewing as well. But thank you very much for everyone who's taken part. I really, really appreciate it. And thank you, Zoe.
My pleasure. Thank you very much too.
Bye.
Bye, everybody.